Hey everybody, this is Dr. Kyle with Columbia River Chiropractic, bringing you your next tip for Tuesday. I get a lot of questions from our patients about what are the supplements I like to take, and kind of ask me about different tips about when, how, should I have food, should I not have food around these supplements. So that's what I was going to do for you guys today in our tip for Tuesday. Just break down what I typically do for my functional necessary supplements and give you a few tips to walk away with them. So my first one that is kind of my everyday, especially in the winter time, is a vitamin D supplement. Now we happen to carry a Thorne supplement that has vitamin K2 mixed in it. Those two supplements basically need to match each other to make sure, match each other from a ratio standpoint to make sure that your body is utilizing it properly. But vitamin D is connected to everything from autoimmune conditions to cancers to musculoskeletal issues, neurologic issues. So making sure that we have the right amount and enough in our body is a really important thing, I think. Vitamin D especially is one I encourage patients to take early in the day because typically we get it naturally from the sun. So when we wake up and have sunshine outside our window, we kind of make that connection between vitamin D stimulation and being awake for the day. So that's kind of my big tip with vitamin D. Probably my next favorite supplement I personally take is magnesium. We've made some videos on the importance of magnesium and the various types in general. I take magnesium glycinate, and it's just because it's kind of a good overall generic supplement to consume for basically regardless of your age, regardless of your particular needs. It's just kind of a good, solid, reliable supplement. Anyways, magnesium, remember, is very good for muscle health, smooth muscle, skeletal muscle, even digestive motions. And this is one that I typically encourage this particular type to take early in the day just to get your muscles kind of designed for movement throughout your day. However, there's another one that I take in addition that is called magnesium threonate. It's a different type. It's been known to penetrate our blood-brain barrier, so it's very good for our neurologic structures like our brain, our central nervous system. And this one I actually encourage people to take just before they go to bed. So there's kind of a distinguished nature of those two. And then probably my next favorite supplement we'll cover today is omegas, specifically omega-3s. Now, we've also made a separate video on this, but remember that the human body requires two types of omega-3 fats. We get them from plant sources and animal sources, and we require both. We can't have one and have it convert into the other. So remember that. So typically, with someone that's eating a healthy diet, getting seeds, nuts, we just need to supplement with the animal version, which I like fish oil. And fish oil and omega-3 fats in general, what they help to do is combat chronic inflammation. So our body is most efficient at doing this when we sleep. I encourage people to take fish oil just before they go to bed so you can kind of optimize that anti-inflammatory effect throughout your night. And that's regardless if you have particular ailments like joint pain, back pain, or if you have cardiovascular issues, neurologic issues, those kind of things. So again, to summarize, these are kind of the supplements I take. These particular four, vitamin D and K together, magnesium glycinate, magnesium threonate, and fish oil. Those are more or less my functional supplements. There's a lot of other good options out there, but I think these are ones that more or less everyone needs in certain amounts. And hopefully those little tips I gave with each one of the supplements kind of goes and suits you well. Again, my name is Dr. Kyle, Columbia River Chiropractic. Thanks for watching.